Hello, I'm Dr. Edmund from drko Juru. Since the start of MCO 3.0, lots of patients coming to me with hair loss problem. So many wonders, what is the association between MCO 3.0 as well as hair loss? So why is this occurring? Stress is definitely one of the factors that can cause acute hair loss issue. With COVID-19 raging through our country, as well as people's livelihood being affected by the MCO 3.0, many people, I'm sure, will feel stress. And stress is definitely a potent trigger for hair loss. Telogen effluvium is one of the many hair loss conditions that can be triggered by acute and significant stress. Emotional stress can lead to many of our hair from a resting or growing phase push towards a telogen phase, which is a resting or falling stage. This will lead to acute hair loss problem and leads to hair thinning. Stress is also a potent trigger, especially for those having chronic hair loss issue such as androgenetic alopecia, alopecia areata, as well as female pattern baldness. This issue can be potentiated or accelerated by stress alone. So, what should you do if you are suffering from acute hair loss during this period of time? Definitely seek medical professional opinion early on. Stress can lead to permanent balding if not handled early. So as a doctor, what can we do for you? Number one, we would diagnose the cause of hair loss, whether you are suffering from androgenetic alopecia, alopecia areata, or telogen effluvium, or is there any other cause that is triggering your hair loss? Secondly, we will perform any investigation needed. For example, we might take some bloods to rule out any medical condition that you might be suffering, or in severe cases, a biopsy, a skin biopsy may be indicated to pinpoint the area that is problematic. Next, in terms of treatment, what can we do? We can prescribe certain medication that, number one, prevent further hair loss. Number two, increase blood circulation to the hair so that your hair receives the nutrient required for it to grow. And third, we may give you supplements and hand vitamins so that your hair receives the nutrients that it needs to grow. After all, hair growth is a slow process. So when you start your treatment, you will have to give it some time, example 3 to 6 months, for you to see the gradual improvement. Hair treatment such as injection of the scalp using PRP or hair peptide is proven useful to treat acute hair loss, and it might be beneficial to you. Definitely discuss this option with your doctor. Lastly, hair loss is very common issue, and it not only affects the outer appearance of you, but it also can significantly affect your self-confidence, and hair loss can trigger a cycle of having hair loss, and you get more stress over it, and the stress induced by your hair loss may further on induce more hair loss. This cycle can go on until that you suffer significantly hair baldness. So don't wait and get medical treatment early if you suffer from hair loss.